Welcome to the Health and Lifestyle Hour program that usually runs on Thursday at 5 p.m. at 8 TV. And today I'm Dr. Hilary Aheisibwe, and we're going to talk about birth injuries. Now, birth injuries are a leading cause of morbidity or sickness among women and children, newborn babies, and women following birth. So as we have said in the introduction, the birth injuries can be grouped into two. We have those which are occurring to the babies, and also have birth injuries which are occurring to the women. And the purpose of this discussion today is to create awareness to the potential mothers and children out there and families out there to know what actually can happen during the time of delivery, and as far as these injuries are concerned, not only the mothers and families out there, but also to our fellow health workers and to whom it may concern. They should know what the birth injuries are. So in women, a number of injuries can happen, including but not limited to uterine rupture or rupture of the uterus. The rupture of the uterus is very common. We shall see under what circumstances. Perineal tears, these may include tears of the cervix, tears on the vaginal walls, and even the perineum itself, which can result into what we call the fistulae. The fistulas are of different types, and among them is we can have communication between the vagina and the rectum, and that is the recto-vaginal fistulae. We can also have communication between the vagina and the bladder, or vesico-vaginal fistulae. So those are the two types of fistula that can happen, but even more damage can happen. Still, to the mother, there are injuries that may not be physical. What I've talked about are the physical injuries: the uterine rupture, the fistulas, which we have classified, the postpartum hemorrhage, that is excessive bleeding following vaginal delivery. Previously, some women used to get what we call a foot drop. It's getting less and less common, but some women unfortunately will get mental health disturbances, including what we call postpartum depression at the worst. Postpartum depression is quite common according to studies. A study by Dr. Okero Maxwell, Hilary et al. Found that actually we had significant prevalence of postpartum depression. Some mothers can get postnatal blues. Also, some form of mental illness that can happen, and unfortunately they can go unidentified. Some of these women who give birth, and some of them are not willing to breastfeed their babies. Some whom you hear that they have maybe thrown their children in the toilet piece or strangled their babies, sometimes because of this postpartum depression. So birth injuries are real. We live with them, and we must create awareness so that everyone knows that they are around with us and therefore must be paid attention to. In babies or in the newborns, or what we call the neonates, we can also get birth injuries. Birth injuries on the head, in the head and brain. Some babies may get intracranial bleeds or bleeding into the tissue of the brain, or even into the spaces. For example, the ventricles in the brain, that is intraventricular bleeding, and that will happen whenever one has had a difficult delivery, and sometimes instrumental deliveries. The babies, if at the time of vaginal delivery there is force in trying to make sure the baby goes through the birth canal, they may sustain fractures of the limbs, of the arms. For example, the clavicle bone can get broken in the process. The long bones in the arms can get broken, and some babies can get damage to the nerves, and that's at the time of delivery. Any other injuries to the baby can happen, sometimes even at operative delivery. We have had cases of where a baby's arm was cut off. We have also had cases of where a baby has had cuts on the skin or at any part of their body at the time of delivery. So those are some of the birth defects, birth injuries that can happen. Babies, especially who will get birth asphyxia, will have a difficult life ahead of them as they grow up, because some of them will get cerebral palsy. These are the ones who will not achieve their milestones. They will not achieve the required intelligence that they need to hustle through this life. They may delay to stand, may have cognitive disabilities, they may not do well in class, have a low IQ, and so birth injuries are a very serious event. Some unfortunately may die depending on the severity of the birth injury. So that is to the children. The same can happen to the women. If a woman has ruptured uterus and it's not quickly recognized, they are going to die. Still, as a result of birth injuries such as ruptured uterus, some of these women are going to have the uterus removed. We are going to perform a procedure called hysterectomy, and if the hysterectomy is done, if this woman was giving birth to their first child or their second, then most likely their fertility desires will end there. So these birth injuries are real and they are very serious. A number of women who develop the fistulas that I've talked about are going to develop, they are going to have uncontrolled leakage of feces or stool, and controlled leakage of urine, and this too has an impact. The social stigma that they face, but also the discomfort that comes with those complications. Some can get permanent deformity. For example, there used to be in some difficult deliveries what they used to call symphysiotomy. So the symphysis pubis, the health workers, the midwife or doctors of that time, it's now obsolete. They used to try to, as much as possible, cause extension of the hip or the pelvis by trying to open at the level of the symphysis pubis. So some women could get such injuries and permanent deformity. Thank God that has run out of fashion and is no longer being done. There used to be a procedure called internal cephalic version for babies who came and they were breech or seated. So the health worker would go in and try to use their hands to rotate the baby until the presenting part was what is needed. So there used to be so many associated injuries, but also that has fallen out of fashion. We are no longer doing so much of internal cephalic version. We also know, however, that a lot goes on in the communities. The traditional birth attendants, some of them are still performing some of those maneuvers. We have seen cases where mothers came, maybe because it was an arm prolapse, and the people have literally tried to tear off the arm in trying to manipulate the babies, causing so many injuries to the baby. So it's a very serious issue. So what is the way forward? How are we going to manage the mothers who sustain these injuries? If a mother has a ruptured uterus, yes, we can, as much as possible, try to save the uterus if they still have fertility desires by repairing, but this is if the uterus is not badly damaged. There are currently a number of camps running to try and repair for those who have got the fistulas, those birth injuries. And these services are in a number of hospitals, usually C camps. It's usually incumbent upon us to inform our colleagues, our relatives, whenever these services are being advertised. Those who get uterine prolapse, the uterus prolapsing because one has had difficult deliveries, or one has had multiple deliveries, or one has had very many vaginal births, are also quite common and can also be managed either conservatively or even surgically. So even when one has got these birth injuries, it's not good that they should keep home. And every one of us has someone out there whom they know, a relative or a relative's relative or a friend's relative that has some of these birth injuries that need to be addressed. So the message out there is that yes, if the injuries have happened, then there are services to try and correct these birth injuries. So the babies, when a baby is born, and because now they have birth asphyxia, they are not able to, then the solution is let them be taken to a hospital, a children's hospital, a neonatologist to see them and manage accordingly. Those who have developed, let's say, clavicle fractures or any other bone injuries, then there are now currently a number of orthopedic surgeons willing to help these babies. But what is important, and the main purpose of our discussion today, is to make sure that we don't have these injuries happening. The roles are still two-way, the roles of the families, of the pregnant women, but also we have the roles of the health workers, the midwives out there, the doctors out there. One, for the mothers, attendance of antenatal care is very, very important, because it is during antenatal care that some of these risks are identified early. For example, if someone has had 2 previous section operations, deliveries, then it is not in order that they should be subjected to attempts at vaginal delivery, because their risks for getting ruptured uterus are very high. And usually at antenatal care, these women are seen and classified as high-risk mothers, and therefore specific attention can be paid to them. So attendance of antenatal care, delivery, attending births by skilled birth attendants is very important. By skilled birth attendants, we're talking about trained midwives and trained doctors, preferably obstetricians and gynecologists. Or while under their care or with their attendance at birth, then you're going to have reduction in the possibilities or in numbers of birth injuries. So those are purely things which are under the control of our mothers, our women out there. Because if one, for example, hasn't attended antenatal care, or if one presents themselves to the old women in the neighborhood who are known to help or to attend to births, then sometimes things can come in an unexpected manner. For the health workers, it's usually about, again, being able to identify through history taking which women are at risks. Through investigations like ultrasound scan, one is able to tell that this baby is big, maybe bigger than what the woman has been giving birth to, or maybe someone has macrosomia, they have a baby greater than 4.0 kilograms. And the best methods for delivery can be discussed at that point, thereby preventing the obstructed labor, which can result in some of these complications that we have talked about. Thank you.